What's going on, everybody? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises to help you if you have knee pain when going up and down the stairs. So if that's something you're experiencing, stay tuned for today's video. If you're new to my channel, my name's Dr. Tom Walters and I am an orthopedic physical therapist. So when we think about knee pain with going up and down stairs, this is a very common symptom that people tell me when they come into physical therapy. And typically it's related to pain on the front of the knee, the anterior surface of the knee. And in most cases, it's related to one of 2 issues. The first one is patellofemoral joint pain, which basically means pain behind your kneecap. Behind our kneecap is a joint called the patellofemoral joint. And when people have pain from there, they'll have kind of a sharp pain at the front of their knee that they can't touch because it's back behind the joint. So that's one of the 2 things that can cause pain with stairs. The other one is patellar tendon pain. So the patellar tendon goes right here from the bottom of your kneecap. There's a little point on the bottom of your kneecap. Your patellar tendon goes down and attaches down here on your tibia. So if you get pain below your kneecap, kind of in this region, then you may be having what's called patellar tendinopathy, basically patellar tendon pain. Those are the 2 most common reasons people have pain with stair climbing. I'm going to show some exercises today that can help with both of those issues. So let's get into the first exercise. For the first exercise, we are going to perform a soft tissue mobilization of the quadriceps muscles. Basically, this is a self-massage technique, and you're gonna use a foam roller. There are shorter foam rollers like this and longer ones. Either one works. I'll put a link down in the description if you need to get one of these. They're great for lots of different massage techniques. We wanna massage the quads because they run down over the top of our kneecap, and then our quads turn into our patellar tendon. So both of the pain conditions we talked about earlier can be affected by quadriceps muscle tightness. So what we're going to do with the massage technique is basically just try to release some of that, get some blood flow into the area. A lot of people find these techniques help with reducing pain. So what you're going to do is set your foam roller down so that it's running perpendicular to the length of your thigh, and I'm going to pretend like my right leg, my right knee has the pain in this case. What I'm going to do starting out is just put both of my legs on the roller, and I'm going to just walk my arms kind of along the floor and massage the front of my quads. So our quads are 4 different muscles. So when I'm on the front like this, I'm mostly going to target rectus femoris and a muscle called vastus intermedius. I'll kind of hit all of the quad muscles, but in this case, I'm a little more focused on the muscles in the center of the thigh. So just spend somewhere around 1 to 2 minutes kind of working through. If you find a spot that's particularly tender, you can just pause on it, take a few deep breaths, see if you can get it to relax, and then just kind of keep moving, looking for other tender points. So I like to do one variation like this, where I'm directly on the center of the quads. And then what I'll do is I'm going to roll to the side. Again, the pain is on my right leg, so I'm going to roll at sort of an oblique angle, and I'm going to target the biggest quadricep muscle on the side of the leg, which is called vastus lateralis. And so I'm going to roll all the way down, not onto my kneecap, just above it, and kind of work through this whole range. So I'm not all the way on my side, because that would be on the IT band. I'm at a 45-degree angle, still on my quadricep muscles. Okay, so just work through here. A lot of people find that this particular technique for vastus lateralis is the most helpful. I have a really tender point right here. Sometimes even spots in the quad will refer down into the knee joint. So just work your way through, spend 1 to 2 minutes releasing these muscles, and this is a great technique to start with, especially in the early stages of rehab where your symptoms are more acute. For our second exercise, we're now going to stretch the quadricep muscles. The same idea here. If we can improve the flexibility of the muscles and reduce some of the tension, it will help to take stress off of those anterior knee structures. So I'm stretching my right leg, so I'm going to lie down on my left side, and what I'm going to do here is grab down by my ankle and then pull my thigh back, pull my hip into extension until I feel a stretch on the front of my thigh. I basically want to get to a point where my thigh is in line with my torso. I should have kind of like a straight line from my shoulder down to my knee, and again, looking for a stretch right on the front of the thigh in the quadriceps muscles. This is sort of what's called the classic runner stretch. You can also do this in standing. Most people do this stretch in standing, but I also like it lying down as well. So you're going to hold for 15 to 30 seconds, You want to perform 2 to 4 repetitions of this stretch each day. Okay, so that is our side lying quadriceps stretch. For our next 2 exercises, we're now going to work on strengthening our quadriceps and our glutes. When we think about going up and down the stairs, that movement incorporates our knee extensors, our quads, and our hip extensors, our glutes. So we want those 2 muscle groups to be strong. And in a lot of cases when people have knee pain, one of the first things we do in rehab from a strengthening standpoint is to focus on the glutes. We have quite a bit of research showing out there that glute strengthening can help reduce knee symptoms. So what we're going to do here is a modified single leg squat, and we're going to do this in a hip biased fashion so that we strengthen our glutes more than our quads, just to help alleviate some of the stress on those sensitive knee structures and again strengthen our glutes. So I'm going to show from the side here. What I'm going to do is stand on the leg that's painful, and I'm going to do a single leg squat, but to make this more glute focused, I'm going to lean my trunk forward and go down as far as I feel comfortable. If you hit a spot where your knee starts to hurt, then just stop there and go back up. Sometimes I call this a speed skater squat because it kind of looks like the position that a speed skater would be in. So you're just going to go up and down like that. If having your other leg off the ground is too hard, you can touch your toe over there. So you can kind of take a little bit of weight off of this leg, and it helps with balance if you just touch that toe. Don't push with this leg. Try not to push with the other leg. Just use the toe touch kind of for balance. And what you're going to do is just go up and down like that as deep as you can, and you're going to think about performing 3 sets of 10 to 15 repetitions. And you can rest for somewhere around 30 seconds to 60 seconds between sets. So rather than a normal single leg squat, maybe where my trunk is more upright, which is more stressful on the knee, again, I'm going to lean my trunk, I'm going to flex my trunk, which takes stress off of my quads and my knee and puts more of it on my glutes. This is a great way to strengthen those hip extensors, those glute muscles, so that you're better able to go up and down the stairs. Our last exercise here is going to be the most challenging, and this one is going to be more knee focused. So just move on to this exercise when you can do the last one, in particular the third exercise, with minimal symptoms. So this particular step down exercise is going to help to improve the capacity of the anterior knee. So this is really going to make the knee more resilient and make it easier for you to do stairs. So what we're going to do here, I'm going to show this from 2 different angles. So starting out facing you, what I want to do is position my painful leg up on top of the step, and I'm going to put my hands on my hips or out to the sides for balance, and then I'm going to reach down slowly with the other leg, touch the heel, and then come back up. Now there's a few things you want to pay attention to on this. When you're going down and you're going through the movement, make sure that this knee doesn't collapse in. This is called dynamic valgus, and it can make certain knee pain symptoms worse, especially knee pain related to that patellofemoral joint behind the kneecap joint. This is something you want to pay attention to not only in this exercise, but also in the last exercise. Really make sure you're controlling that knee position, keeping your thigh in neutral versus letting it fall in. Okay, so you want to think about that from this forward angle. I'm going to turn to the sides. You can see what this looks like from the other angle. I'm basically bending down, touching my heel. I'm not pushing off. Don't touch with your toe because you'll be tempted to push off. So touch with your heel and then come back up nice and slow. Again, this is going to strengthen our glutes and our quads, our hip extensors and our knee extensors. And we're once again going to think about 3 sets of 10 to 15 repetitions with somewhere around a 30 to 60 second rest between sets. It's also nice to be near a wall like this. So if I'm strengthening my right leg, I like to have my left arm near a wall just for balance, just to make sure you're safe during this exercise. Also, tempo is really important. You can see I'm going pretty slow. Really try to go slow, work on your neuromuscular control and building that good, slow, controlled strength. Okay, so that is our 4th exercise. It's called the step down exercise.